Now are you able to see the screen now?
Yes.
Yes, sir.
Yes, sir.
Yes.
Seventh question clear, right? Now tell me eighth question answer. Tell me eighth question.
Option B, sir.
Option D, sir.
Option D.
D, sir.
Mhm.
Option D.
D, sir. D option.
Mhm.
B, sir.
Option D, sir.
Option B, sir.
Option D or B?
B.
D.
B, sir.
Simple. Whenever patient has pregnancy, if they not mention the weeks of gestation, we don't know, right, what is the trimester. They are saying simply delivery, pregnant and they delivered. But what type of gestation weeks we need, no? Trimester, weeks of gestation compulsory we need, right? Simple, guys. Remember, in inpatient we should not code unspecified, right? When patient have specific type for the diagnosis. Yesterday I said na acuity or specificity type query. Whenever for the diagnosis you have specific codes in the index, we should not go with unspecified. That's why we should not code unspecified trimester. We need to find the trimester. We need to raise the query for trimester. We need a specific type of trimester. Clear? Huh? So do not go with default unspecified weeks of gestation or unspecified trimester. We need to raise the query for trimester and weeks of gestation if they're not mentioned in the pregnant document. Ninth one. Here they're raising the POA status for POA. Present on admission type. While we are raising a present on admission query, they are asking yes or no. Is this is a complaint query? Why or why not? Yes or no format was valid or not here? They ask. For raising a POA status, can we raise in yes or no format or not?
Yes, see the ones.
C1.
Yes, sir. C1.
We can raise in yes or no format, no? I said right. We need to raise in yes or no format. Okay, what type of queries we need to raise? We discuss now, like cause and effective, POA indicator, pathology, laterality. So POA raise type of queries we need to raise in yes or no format. 10th one. Based on the indicators, identify the diagnosis. So tell me which condition the indicators are supporting.
Bronchitis.
B.
Acute bronchitis.
Bronchiolitis.
B.
Bronchiolitis, okay? When patient have runny nose, RSV, wheezing, these are the indicators of bronchiolitis, not bronchitis. We have RSV related bronchiolitis code. Have you idea? Bronchiolitis due to RSV.
Yes.
Okay, these are related to bronchiolitis, runny nose and all. Not bronchitis, bronchiolitis. Next, 11th question. So, following a vertebroplasty for a fracture of thoracic vertebra, the patient developed a cement embolism. From this information, can coding professional verify a complication occurred or not? This is a complication or can you code vertebroplasty first? How we need to code? You will go with embolism or complication? So remember, it was a complication. Simple, guys. If you while you are coding the cement embolism, no, in this code they mention directly code first complication. Okay, code first concept. This is a code first concept. Yes, code first note instruct uses complication code with cement embolization. While you are coding this code, you will get the code first complication. The code should be I2695. Under I2695, you can check ICD book. By today, all material I will share with you. Don't worry. Okay. All the recorded queries, books, everything I will share because group was done.
So we don't have books of ICD. So is it
That,
okay?
that only I'm saying. I will share all the material today only I'm saying.
Okay. I
Why?
mean, this is enough to lead in computer, right? Lab.
Yeah, yeah.
Okay.
This code I2695. I20. Not I26 here only. Cement embolizer. Yeah. Embolism, cement embolism code. If you know, you can go with guys, but you will get the code first concept. Okay, code first concept you will get compulsory. Code I don't know exactly, so you will get the code first concept. You can lead code. Okay, definitely you will get code first concept for this cement embolization. Okay, no. So we need to go with first T series code, complication code. Then we need to go with cement embolism code. Clear? Huh? Okay. 12th question, tell me. When a complaint query remains unanswered, what is the next step for the coding professional? Because you raise a query, but they are not answering. What we need to do? You raise the query, but they are not answered. What action we need to take? Just think logically, ask him director, or alert to the CEO, or refer to internal
Option C.
escalation
Option
policy,
C, sir.
report
Refer
to
to
the
the internal
physician to the
escalation.
peer review. Just we need to refer the internal escalation policies. That's it. No, we should not directly go with CEO and him director. Just we need to refer the internal escalation policy team, and they will follow process. Next, 13th one. 13th one, how we need to go. So here, patient present to the hospital with left lower quadrant pain with normal white cell count. X-ray showed sigmoid diverticulosis. Patient underwent resection of sigmoid colon with anastomosis, developing a post-operative ileus after surgery. Nausea opted after resolution of the ileus. What is the query opportunity in this case? What query we need to raise? So was the diverticulosis is perforated, or what was the nausea post-operative? Was there an associated abscess with cellulitis, or was the post-operative ileus is a complication? What query we need to raise?
D, sir. Was the
Was the
post-operative ileus a complication?
Yeah. It was a post-operative complication or not, we need to confirm. Because it was developed after the surgery, no? It was related to the complication or not, we need to check. That's it, simple. Okay?
Amma.
Because nausea was the symptom of ileus. Okay? It was the symptom of ileus. So leave it about nausea. So because of nausea, we should not raise the query. Then was the diverticulosis perforated? No, they documented only sigmoid diverticulitis and they done the procedure also for that. Okay, so that was also clear. Now we need to check that post-operative ileus was complication or not. It was due to the procedure or not. They said simply post-operative ileus, but how it was developed due to the complication or not, we need to check.
D.
So option D. Which of the following is true about verbal queries? Simple, guys. Verbal queries and written queries. Simple. I will explain this concept. So verbal queries means while we are raising a query now, if you given the verbal like voice, mail, or phone call your concern, it should be verbal query. If you raise your query in the written format, like you message type or fill the form tool and all, it should be written queries. So nowadays, no one will raise these verbal queries. All are following the written queries only, query template only. Verbal means if you raise your concern through voice, mail, or phone call, should be verbal query. Written queries in the written format. Written queries. So they asking simply, was the which of the following is true about verbal queries?
D.
Mhm.
D option.
D.
D.
B. Mhm. B.
B.
D, sir.
D.
B.
B. They must have a written response in the health record for coding purpose. Okay, written response also they need must have in the record. Okay, for coding purpose they need to raise the while you are raising the verbal query, they need to raise your things in the record again. If you tell in the verbally again, how we can code, how we can code the diagnosis. They need to mention. Suppose they're not documented your concern in the record. So now you called in the verbally. If again they said you can code means it was valid, or they need to mention the thing in the record. In the healthcare record, they need to document, or just they can also reply in the verbally enough. You raise a concern in verbally. In the phone call, you asking, suppose there is no specific type of CHF. Then provider states simply you can take as systolic CHF. That document was enough to code systolic, or they need to mention in the record again. They need to correct the healthcare record again in the document or not. Tell me. The phone call is enough, or they need to mention in the record again?
Mention in the records.
They have
We
to
have to
mention.
mention.
Because now I said already first to write what they documented, that's done. We need proof, right? If you coded systolic as per the provider, if insurance company again denied means how you can answer them? They will tell where is the document, show me, means how can we show? We can't send the phone call conversation again and again. No? It was not a valid. So whatever you raise the query, they need to give your response must in the written format compulsory in the health record. Now tell me 15th question, for which condition you will raise the query here.
Hypertension.
Good, hypertension. Correct. Hypertension. Is the acute renal failure linked to the diabetes? No, right?
No.
Patient has history of diabetes, takes metformin and lisinopril, blood sugar monitor, discharge summary, final diagnosis, acute renal failure and diabetes are documented. Not required linking by default. That's not. Does the patient have chronic renal failure? No. There is no clinical indicators. Is the diabetes is out of control? No support. For hypertension, the documented lisinopril. Correct? The documented lisinopril. So for which condition the lisinopril we are using?
Hypertension.
Hypertension.
Hypertension. So the patient have hypertension or not, we need to raise the query. Simple, based on the indicators. Next. 16th question, tell me. It was the complaint query or not, they asking?
C. No, sir.
No.
No. C, sir.
No. No, right? Because the document, all the indicators are supporting for
C, sir.
which diagnosis?
Leading non-complaint.
Urosepsis.
Sepsis, no? All
Sepsis.
the indicators
Urosepsis.
are supported for sepsis. Remember, there is no code for the urosepsis. Leave it about urosepsis. There is no specific code for urosepsis. Okay. If they documented urosepsis, we should not consider as sepsis. It was a basic ICD guideline. No?
Yes.
There
Yes,
is
sir.
no specific in the urosepsis. So leave it about urosepsis. All the indicators are supported for which diagnosis here? Based on the options check.
Sir.
Yes, because the provider indicated type of sepsis. No. Yes, because the provider can answer negative and supply. No. No, because the question is leading the providers to a specific diagnosis, make it non-compliant. No, because no other option besides sepsis is offered. At least 3 options must be given to be complaint. Why we need to give minimum 3 options for raising a sepsis query? So we need to go with non-complaint format. Based on the indicators, directly you can ask, are you treating sepsis or not? Correct? These all the indicators supported for sepsis, no?
Yes.
Yes. So it was make it in non-complaint version you can raise because there is no unrelated symptom, unrelated indicator. All are related to the sepsis only. Clearly, we can able to raise the query for sepsis based on these indicators. Directly leading. Next, 17th. Like here they're saying patient admitted with acute and chronic kidney disease. First thing, tell me, when patient have acute and chronic renal failure, how we will code? How we need to code when patient have acute and chronic renal failure?
We got both the acute renal failure and CKD, chronic kidney disease.
Yes.
Based on
We
stage.
need to code both. There is no
Both.
combination code, correct?
Yes, sir.
We need to code both acute and chronic. Remember, while we are coding same diagnosis, acute and chronic, they documented, but there is no combination code. At that time, we need to code first acute in the sequence, followed by chronic. Okay, we need to code acute renal failure first, then chronic renal failure. In the sequencing, now patient have, there is no documentation of the CKD stage in the record. Would the following query be compliant? Dr. Jones thought, this patient health record, no CKD stage is reported. In an outpatient procedure H&P from last month, the CKD was noted as stage 3. So now please provide the clarification of the CKD. Stage 4 or other are undetermined. So which option is correct? So no, not enough clinical indicators are presented for the type of CKD, or no, more multiple choice answers must be supplied, which means you need to give all the type of CHF types. Here in the options they given only CKD stage 4, right? So you need to provide remaining all options in the format like multiple choice, or yes, information in a previous health record can be used to specify the condition, or yes, it acceptable to use previous health records to mine for diagnosis. So what is the exact answer?
A
Based on the
option.
previous record, they find it was a stage 3. So can you assume that stage 3, or we need to rise again for the stage?
A option.
Again, we have to raise.
The option.
Yeah. Why you will get A? I don't know. Why defaultly we can eliminate?
B.
Why we need clinical indicators here? Patient have CKD, they not mention the stage, and from the HNP they thought they find CKD stage 3.
The option, sir.
So from last
C
month
option.
HNP, they find CKD stage 3. Now you need to rise for the more multiple choice. If you they given only CKD 4 other and undetermined in the options. If you want CKD stage now, you need to mention all the stages, right? How you can rise only for CKD 4?
Option C, sir.
Zero.
Otherwise, if you consider the CKD stage 3, you can code directly the CKD stage 3, like as information in the previous health record can be used to identify specific condition. Or You need to provide multiple options, like multiple choice answer must be give more options like 1, 2, 3, 5 options also. Or yes, it is acceptable to use previous health record to mine for diagnosis, which means we can assume the diagnosis from the previous health record directly. What is exact answer here now? We need to take the specificity. Option C. So, yes, information in a previous health record can be used to specify the condition. Already they said CKD stage 3. Now they not mentioned stage. We can go with CKD 3. Clear? 1 month back only they said CKD 3. So now we can go with that CKD 3. Clear? Huh? We need to take the specificity. No need to raise again query for the CKD stage. Already they documented 1 month back only CKD stage 3. Now we can go with CKD stage 3. You can take the specificity from that record. 18th one.
Sir, but if documentation is more than 1 month, then also we can take it from past.
Actually, no, HNP we need to consider only 30 days. Okay. Depends on the documentation. Okay. Outpatient procedure HNP we can consider 30 days. I will give these guidelines in the complaints for which documentation, what is the timeline standard for the documentations. Okay. We have timeline standards for depends on the documentation that I will explain in coming classes. So now HNP we can take from the 1 month period from outpatient. Before the admitter, no, we can consider HNP from past 30 days. I will give the timeline standards where they mention the diagnosis and all. Okay. For what is the timeline standard for each diagnosis? Clear? Now, 18th question. So here, patient admitted an acute care facility from SNF. The patient has multiple sclerosis and hypertension. During the course of hospitalization, a decubitus ulcer is found and they debrided at the bedside by physician. There is no type operative report and no pathology report. What should be coding professional do? We need to use an excisional debridement code, as these charts are rarely reviewed or to verify the excisional debridement, or code with non-excisional debridement procedure code, or query the healthcare provider who performed the procedure to determine if the debridement was excisional, or eliminate the procedure code altogether.
Option
Yes,
C.
sir.
Option C. We need to raise the query for type of debridement. It was excisional or non-excisional. Okay. We need to check the type of query. We should not assume by default it was excisional or non-excisional type. If they not documented the type of debridement or depth of the debridement, like at what level they done the debridement. If they not documented depth also, we need to raise the query for the depth also. Simply, they said only debridement performed. They not mentioned what depth, like muscle level or tendon level or skin level. Then also we need to raise the query for depth of the debridement also. Clear? If they're not documented type and depth, we need to raise the query for type and depth of the debridement. Next, what should coding professional do when creating a complaint queries? So query once without further follow-up, query multiple times until the desired diagnosis is provided, query once with additional follow-up is necessary, query unlimited times. So if you raise the query, you can raise multiple times Or if you raise the query once without further, if they are not responding, you should leave the follow-up, or you will raise multiple times query again and again. Or
Option
you
C.
will raise the query and you will follow the follow-up, or query unlimited time.
C.
We need to raise the query once only. Then we need to check additional follow-up about the query. That's it. We should not raise multiple times same concept query. Just you need to follow up about the query. Okay. We need to raise the follow-up. 20. So it was they asking it was a type of SR no query or not. Correct? COPD part yes or no would be considered as a complaint query. It was yes or no type or not, they asking. This query format was considered as yes or no type or not. So it was a valid format of yes or no or not, because they documented X-ray report COPD. There is no further evaluation, correct? There is no medication, no treatment, further evaluation of COPD. Just chest X-ray suggested, then Dr. Reynolds based on the chest X-ray report from 23. Do you agree with radiologist finding of COPD for this patient? Yes or no? It was a yes or no format or not? From here, they raise the query. Okay, up to here, they documented. Up to here, they documented like patient has finding suggestive COPD on chest X-ray. There is no medication, there is no treatment, further evaluation of the COPD. Just they find in the X-ray report COPD. Can we quote from the X-ray report?
No.
No, sir.
No. No, because there is no treatment, no further evaluation. Now the coding professional raised the query. The code renals, which means radiologist, documented chest X-ray report COPD. Can we code or not? That like the diagnosis was present or not? Can we raise this format in the SR no format or not?
Yeah.
It was SR no format acceptable or not?
Yes, sir.
It was
Acceptable.
the SR no format only, no?
D.
After the
Option A, B we can eliminate easily. Because
Mm.
patient have COPD in the X-ray report. Just we need to confirm that X-ray report diagnosis was present have or not. In two options, you will raise the query concern. Not only pathology report, guys, any X-ray report, nutritionist documented diagnosis, consultant documented diagnosis, but there is no further evaluation. At that time, simply we need to confirm the diagnosis. Chest X-ray documented COPD, patient have COPD or not? Please confirm. Yes, no. Two formats enough, right? Two options enough, no? It was a yes or no query. Yes, yes or no query can be used confirm the diagnosis for a licensed practitioner, not considered a provider. You need to raise this query because here documented X-ray. Then we need to go with provider confirmation. Yes, all chronic patient conditions should be coded, and it is unclear if the diagnosis is qualified. We should not code directly, right, if the diagnosis is unclear. If the document is unclear, can we code that chronic condition by default?
No.
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 We need confirmation. Okay. So it is a valid yes or no type. We need to raise the query. Option like A, B, C. No, even yes or no query must have multiple options. Why we need multiple options while you are raising a yes or no? Only two options, No, you cannot use yes or no query for substitute another provider's diagnosis. No, we can raise the query if they documented another provider also. For other treating provider documented, we need to ask the query. Why not? Next, 21. So here, what query we need to raise? They done what procedure they performed here?
Laminectomy.
Fusion, sir, actually.
Yes,
Yes,
fusion they done, right?
But bone
First
graft
bone
is not
graft
mentioned
is
here.
So they done fusion. The provider notes insertion of the rods and screws fuse lumbar level. So fusion they done. What query opportunity exists for this procedure?
Bone graft is not
Bone
mentioned, sir.
grafting.
So we need to go with was the bilateral or performed percutaneously or vertebroplasty done or they done bone graft used. For which condition you need to raise here?
Option A, sir.
Option
Yes, sir.
Yeah. Yeah, we need to check that the used bone graft device or not. Okay, we need to raise the query for bone graft device used or not when they performed fusion. 22. Identify the diagnosis. Is there any query opportunity?
Yes, sir.
For which condition?
Vasopressin, severe sepsis, I think.
For sepsis, sir. Option D.
Septic shock. So vasopressin they documented, but here blood pressure also extremely low, circulatory failure. It should be septic shock. Okay. Septic shock, we need to raise the query based on the indicators. These are the indicators supported for septic shock. 23. The documented patient was type 1 diabetes with proliferative diabetic retinopathy. We have surgery for fraction of retinal detachment for macular edema. Which of the following question would be make a complaint query? What query we need to raise here? What is the complaint query opportunity here?
Option A, left or right.
A option.
Laterality.
Laterality.
Yes.
Laterality, sir.
They did not mention which side they documented, right? They done right eye or left eye or bilateral eyes, they done the procedure. Why? Because no, we don't get the procedure correct code. They not documented the site, right or left or bilateral. So we need to code site, right or left or bilateral. Clear? Laterality query we need. Right or left or bilateral. Acuity. Site we need. Then 24. Which of the following is true about complete multiple choice queries? While we are raising a multiple choice query, what is the exact answer like? Which one is true? They must contain every possible option for the provider to choose from. They can provide a new diagnosis with supporting clinical indicators, or they should provide minimum 3 options. They are preferred query format for established POA. So POA, can we raise in multiple choice?
No, sir.
No,
The
sir.
yes or
Because
no query.
No.
should provide minimum 3 options. No, there is no limit, right?
Option
Option
B.
Option A or B, now tell me. The must contain
B,
every
sir.
possible option for the provider to choose from, or they can
Option
provide
A.
new diagnosis.
A, sir.
Option A.
Mhm. So while we are raising the multiple queries, option B, they can provide a new diagnosis with supporting clinical indicators. The must contain every possible option for the provider to choose from. Why we need raise every possible option? Okay, they can provide new diagnosis with support indicators. Here, complaint option. They are asking complaint multiple choice query. While we are raising a complaint query, provider will give the diagnosis, right, based on the indicators. You are forgetting this complaint version and non-complaint version. That's the problem you are facing. Okay. While we are raising a complaint version, non-leading, provider will give the diagnosis. We should not mention the diagnosis, no? Yes or no? Suppose if we are raising a complaint version like non-leading, provider will give the diagnosis based on the indicators. You will provide the indicators. Provider will mention the diagnosis. We should not document the diagnosis. Okay, if we should document the diagnosis, it should be non-complaint version. So here they are asking about complaint multiple choice query. Which of the following true about complaint multiple choice query? Provider can provide the diagnosis with supporting indicators. They can provide the diagnosis. You will provide just indicators. Provider will document the diagnosis. Clear? Yes or no?
Yes.
Explain again. This one.
Simple. First, don't confuse complaint version. While you are raising a complaint query, you will mention the diagnosis or you will mention only clinical indicators. In the query format, you will give only indicators or you will mention the diagnosis also.
Indicator.
Only indicators.
We provide only indicators to the provider. We are asking to provide the diagnosis, correct?
Yes, sir.
Yes. So here, which option was correct? They can provide a new diagnosis with supporting indicators. Whatever indicators you provided, provider will give the diagnosis. It should be a complaint version. If you already know the diagnosis, it should be a non-complaint version, no? Based on the indicators, if you are directly lead the particular diagnosis, it should be a non-complaint multiple choice query. It should not a complaint version, correct? So in the complaint format, simple. You will give only indicators like this and you will ask, please document the diagnosis. So here also they will provide the diagnosis. Next, 25. Is there any element missing in the complaint query or this is the correct format of complaint query? While you are raising a complaint query, they given these 4 options. These options is enough or you need to mention any other option along with these options. See, this is the complaint query format option. They given only these 4 options. First 3 they given. Okay, like only heart failure type they mentioned. And this is the type of query, or we need to give any other options, like some more options we need to add here. No, the query meets the multiple choice requirement. Yes, all options CH must be liquid. Yes, the option for other must be included. No, since only 3 multiple choice options are required, these options are correct. We can give
C.
these are the Options not meeting for the multiple choice. Option A, D, eliminate. You need to mention all the CHF or you need to give other option must.
Other option.
Other option compulsory, guys. While you are raising a query, after all type of you mentioned, you need to mention other type by default. For any format, you need to give other. Okay, other we need to give. Compulsory we need to give other option. So we need to give other option must be included in the query format. Now 26. It was they asking, can you please include which type of CHF the patient has, acute and chronic or other? Identify the following query is a complaint and the appropriate rationale. They asking this format is complaint version or not. They are raising the query, patient has CHF in your discharge summary. Can you please indicate which type of CHF the patient has, acute and chronic or other? This is the complaint version or non-complaint version.
Non-compliant.
Complaint version or non-complaint version.
Non-compliant.
It should be non-complaint version, right? Why we are confusing? It should be non-complaint. It was not a complaint query. Correct? Huh? Here they are directly raising a query only for acute and chronic or one option only they given. Acute and chronic CHF or not. It was directly they lead the position. So no, this is not a complaint query. As this is a leading to the position. Okay, they are directly give the leading. Only one option they given acute and chronic. Okay, if it was complaint means we need to raise like this. All options we need to provide and other. This format we need to raise in complaint version. If you give only one option, it should be non-complaint version. Here they given only one option. So it should be a non-complaint version leading directly. 27. The only apparent CC patient account is hyponatremia. The problem is that even though the sodium level was noted 129 and there is documentation of repletion, the provider does not actually state hyponatremia. Which of the following query elements would make this is a non-compliant query? What is the exact answer here? Option A. Addition of hypernatremia in list of multiple choice option. We need to give hypernatremia also. They documented only hyponatremia. We need to document hypernatremia also along with hyponatremia. Next. 28. Read carefully and identify the answer. They are asking here, patient was admitted with pneumonia. Sputum culture was able to identify mycoplasma pneumonia, which of the consulting pulmonologist, Dr. Reynolds, documented as the cause of pneumonia. The patient was also diagnosed with E. coli and UTI. The final diagnostic statement, attending patient Dr. Hawkins, documented E. coli pneumonia and UTI. Is the following a complaint query? Dr. Reynolds, based on the sputum culture, sputum mycoplasma pneumonia and urine culture result, can you clarify what type of pneumonia this patient has? This is the correct format of query or not? See, for whom we need to raise query always?
Attending provider.
Attending patient.
Attending patient. Here, who is the attending patient?
Hawkins.
Hawkins was the attending patient. Renal was the pulmonologist. So here they raised the query for pulmonologist. It was valid for query.
No. C.
No.
C.
No, this query is not complaint as it addressed to the wrong provider. Because we need to raise the query for Hawkins. We should not raise the query for consultant and radiologist. No? So wrong provider they raise. So no, the query is not complaint. It is addressed to the wrong provider. Clear? Huh? So remember, when we are raising a query, we need to raise query only for attending provider, not other providers. Clear? Any doubt? Hello?
No, sir.
No,
Clear.
sir.
29. Just 2 questions. That's it. Over. 29 and 30. That's it.
B, sir, HIV.
Correct. Suppose sarcoma of the lung, the documented, and the given the medication should be antiretroviral therapy. So, antiretroviral therapy for which diagnosis we need to use?
HIV.
HIV. So, HIV we need to raise the query. Last one.
D, sir.
D.
Cephalopelvic
D.
disproportion. The cephalopelvic disproportion was answer. Clear?
Yes,
Okay.
sir.
Okay, guys, I will share this paper with you. These 30 questions with explanation. Answers also available with explanation. You can review again. Okay, if you learn these 30 questions, enough, you will get all the type of query formats here. Okay, I will share with you these 30 questions and I will share all the query format material and videos by morning. Okay, you can go through these documents. Clear?
Sir,
Yes, yes, tell
Okay,
me.
sir.
in 20th questions, I have doubts.
1 minute.
20, sir. 20. Yes, sir. Actually, here we can take the COPD and raise query. So only for chronic condition or acute condition also we can raise.
Any condition we need to raise. If they documented only other than attending